Good morning, everyone, and I really want to welcome all our viewers today here and our very distinguished panelists that we have here on this Sunday morning for an important discussion on Doordarshan. We are also live on all the social media, and this session is really developed today in accordance with the coronavirus pandemic that has really turned around life as usual completely. And with 4 million odd plus cases globally, the world, as everyone says, is in turmoil today. And we are in the midst of an extraordinary crisis, which is unprecedented. A health crisis like this is also impacting our economy in a very strong way, just India's economy, but the entire world. And so during the next 90 minutes, what we will be doing is outlining the issues that all of us are really concerned about and to which we are looking for answers, both on the health front as well as on the economy front. The government, I must say, has taken very, very strong and decisive measures to address the health crisis in the last few weeks. All of us appreciate the very proactive and responsive strategies that we have seen being put into place. And today, everybody is concerned about the graph, which shows us how rapidly the infection is spreading. As we navigate these really unprecedented times, I believe it to be of great value for us to try and make sense of what the new normal, people keep asking that, how the new normal may look like and how do we prepare for it as leaders, as managers, as healthcare workers, as family members, as citizens of India, even as we face our daily realities and challenges at this point in time. So we are joined here today by leading thinkers who are also practitioners and who can give us complete direction towards the way we are headed in the COVID crisis and the economic implications and how we can deal with it every day. I have on the show with me Dr. Randeep Guleria, the director of the All India Institute of Medical Sciences, AIIMS, New Delhi. And Dr. Guleria has flown back late night from Gujarat. We were seeing him yesterday on the televisions in Gujarat. We also have with us Dr. Naresh Trehan, the chairman and managing director of Medanta, and who also chairs the CII's healthcare activities and work. Dr. Kiran Mazumdar Shaw, executive chairperson of Biocon, someone who is also very deeply involved and a leader in her own right as in R&D, not just in India, but globally. We have Dr. Naushad Forbes, the co-chairman of Forbes Marshal, someone who has deep connects with the global academic world and chairs important and very leading think tanks and also chairs the CII's economic work. And last and most importantly, I must introduce the president of CII, Mr. Vikram Kirloskar, who is also the chairman and managing director of the Kirloskar Systems and Vice Chairman of Toyota Kirloskar Motor. So if I may start by mentioning to our panelists who well know this, that this is a Doordarshan broadcast, which really means we have a huge cross-section of audience, business and much beyond, different stakeholders from the society across the country. Second, as we go along, I shall be getting questions also on my device from our audience, which I shall try and bring in selectively to this very, very important and august panel. So let me start by mentioning that our Prime Minister had spoken about just a few weeks back about lives and livelihood. And that's a critical really issue, which is very, very important in terms of balancing. And I will certainly want our panelists, as they talk during the course of the next 1.5 hours, to reflect on that point from time to time. Turning to our panel for their opening comments, first, let me go to Dr. Guleria. Congratulations to you, Dr. Guleria. I must say, you, all of us know, is required everywhere across the country at one single point in time. And it has been a huge firefighting situation for you. And thanks to you for your very cool and composed leadership, Dr. Guleria. We want to ask you that we saw the first incidence of coronavirus in India sometime around February. And almost 3 months later, the number of cases has risen as expected. However, we do not really appear to be close to the peak as one understands. How much longer do you think it will be before the health situation will really be under control. And as a country, how much are we prepared? Our public health systems are, and how much are they able to really tackle, and how much would they be able to tackle in the months ahead, which is going to be very, very important. And another issue which I would request you to touch upon in your opening comments is when and exactly where does one go for testing? When we keep on hearing the shortages of testing kits and so on and so forth, there's a lot of myths around, there are a lot of realities too. So maybe we can understand from you the right perspective, Dr. Guleria.
Thank you very much. To begin with, you're right. We've actually had the first case in February, and we continue to have a rising trend as far as cases are concerned. What is heartening is that the trend is actually not as sharp or as steep as we're seeing in the Western world. And that is because of a lot of interventions that were done early, whether it be international flights, whether it be the early lockdown. And therefore the curve, although it's rising, is relatively flat rather than being very steep. This has given us time to really prepare ourselves for testing, for the COVID care facilities, the COVID hospital, the COVID ICUs, training for health professionals, and also learning more about this virus as it evolves. For example, it was initially thought this is just like any other viral pneumonia. Now we are realizing it has a lot of systemic effects. It causes a lot of clotting or thrombotic state. It causes systemic involvement, whether it be the heart, CNS, or huge cytokine storm. This has also led to modification in our treatment strategies as we have evolved over the last few months. And that has really helped us in a big way. However, it's difficult to predict the future, and a lot of mathematical modeling has been done, but it doesn't take into account many factors which keep changing. The first mathematical modeling, which was done way back in March, actually suggested that the peak would happen in May, and we would start seeing an end of cases occurring somewhere by the middle or end of May. That doesn't seem to be happening. It did not factor in the lockdown, which actually led to flattening of the curve and also extension, or I would say delay in the peak in some manner. When will this peak occur? How sharp will it be is something which is a big question, because there are mathematical modeling which says it will occur in the next 2 months. There's one model which even pushes it all the way to the middle of August. So it's a big challenge as to say how it will evolve. The challenge I think that we have is trying to really see if we can work aggressively on the hotspots. Remember, 2/3 of our country, or more than 2/3 of the country, actually has very few cases or is in a situation which is very comfortable. Most of these cases, more than 80% of current cases that we're seeing, come from these hotspots. And if we are able to really work aggressively, look at a micro planning, because each of these hotspots have their unique problem. It's related to crowding, it's related to socioeconomic status, it's related to the other social factors in that area, which all of you can understand, whether it be the urban slums or whether it be other areas. These challenges are something that are unique to our country, and unless we're able to address them, we will continue to have increasing number of cases, and the flattening of the peak may not happen. So the future is something that I think we will have a peak. It may not be as sharp as what we're seeing in the West. Cases will then come down, but as you mentioned, we will have a new normal. And this new normal will mean a lot of changes in the way we socialize and the way we live. I don't see a lot of large, say, wedding parties happening in the very near future with thousands of guests, as Indians, especially North Indians, are very fond of. Those type of activities will get delayed for quite some time. Even the crowd that one sends to see in the mall will actually be much less. But at the same time, as has been mentioned by many, this is also a way of looking at it as an opportunity for India to really start using this to come into the forefront in the area of science and health, in becoming a world leader in this area, as India became a leader in the IT sector. And that is something that we need to keep in mind, that this should also be looked as an opportunity, because there is a lot of reluctance for a lot of technology and equipment and stuff which is coming from China. we should really look at this as an opportunity to put India in the forefront for manufacturing, health-related products, and also healthcare in the very near future. So when we look at this emerging scenario, it's also to look at it, how can we turn it into an opportunity. Regarding testing, the third question that you had, testing is something that is really one area that the government is working very aggressively on. We started I would say, 4 to 5 weeks ago, doing only around 10,000 tests a day. Yesterday, we crossed 90,000 tests, and we will, in the next few days, cross 100,000 tests per day. Now, that is actually more than what the UK is doing currently. But when you talk of number of tests per million population, it becomes very little, because our population is huge. And if you start saying that we will try and test even, let's say, 5% of our population, that number is huge. It's 7 crore people. That is a huge amount of testing that would be required. So testing strategy will have to be developed. And I sometimes feel that testing has to be done to answer some questions. It cannot be done randomly for everyone. I do agree that there would be some people who will have influenza-like illness, will panic, and will want to get tested. A large number of private labs are being roped in for that. But at a large scale, you would like to do testing to make sure that your green spots remain green, they're not having any COVID patients there. The policy there is to do what we call pool testing. And you would also like to see, can we quarantine and isolate people in hotspots who are definitely positive? The aggressive testing in hotspots may not be a solution in my mind. This may be something which is different from what a lot of people think, because there is a lot of transmission happening with asymptomatic people. And you can't test all asymptomatic people in our country. So in the hotspot, it's more of containment, aggressive lockdown that will work rather than testing the whole population. We will soon have ELISA-based kits which will be able to do antibody testing. So serosurveillance from the antibody will help us. But whatever data that we have suggests that antibodies start forming only after 2 to 3 weeks. So you will be able to not get a positive. Antibody testing will not be useful from the diagnostic point of view. But it will tell you in a hotspot, for example, if you were to do a serosurveillance, how many people have had the infection and become all right. And if that number is large, then you could say that there is now good, let's say, herd immunity in this area, and you need not really worry about it as being a very worrisome area. So these are the sort of 3 answers that I had to the question that you raised.
Thank you. Thank you very much, Dr. Guleria. Actually, you set the agenda for the discussions that follow, and we'll probably come back to each of the issues that you raised, be it the issue of hotspots or the way we are able to deal with it, and even the opportunities that you talked about, as well as the new opportunity, and one would really look forward to seeing how the weddings would look like. So, well, we'll come back to all of that very soon. But let me, and you gave me a very nice segue to get into Dr. Trehan, and to you also, Dr. Trehan, warm appreciation for leading from the front, you, your team, and the entire medical fraternity, of course. And as you make your opening comments, Dr. Trehan, I would request you to reflect on the issue which I mentioned at the outset, that's life and livelihood. We have had a very strong lockdown, that was the lockdown 1.0, then we had the lockdown 2.0, and then we are somewhere around lockdown 3.0. And the economy needs to open up. Everybody talks about it, it needs to open up. How concerned would you be as a doctor? How would you actually, how all of us would really learn to live with COVID in India, perhaps across the world? And I think we would all have to understand that this will exist in our lives for quite some time to come. And therefore, we will have to get back to a normal, which will be a different type of normal. But how do you look at that, Dr. Trehan?
So Randeep has actually set in quite a detailed perspective of where it started and where we are right now and what he feels will happen. On the other hand, we now know that there is a rise in numbers, that there is a storm coming, like we expect that, how steep the peak will be, and with what velocity it will be. The most important thing is peak may come, but how fast it will come will test our preparedness to deal with it. So if you look at it, that today this lockdown has helped us hugely to prepare ourselves in many ways medically to be able to take a lot of the expected problems or numbers that will come our way. But you take situations like Mumbai. Mumbai, it spread so fast and so deep that you can't find a hospital bed for people who are actually need hospitalization. If we are getting calls from Mumbai, please find us a bed in Mumbai of people who are substantially placed in life, means that there is a serious problem. Now, the same thing that we say today, that we have enough Indian companies manufacturing PPEs, we have ventilators on the anvil, we've been testing one which has turned out to be very good. There are others who have done it. So I think this preparedness to a large degree is there, but when you multiply it by our population, it becomes an area of concern. Now, that's the reason why we say how to lift the lockdown, how to take into consideration the livelihood that we keep talking about. So one thing is that it's graded. First thing was that the agriculture sector was opened up, rightfully so. That was the need of the hour. Today we are maybe about 2 weeks, from lifting of the agriculture lockdown. We should test ourselves to say, how effective were we in completing the supply chain from the field to the table? Have we been able to seamlessly solve that problem so that we have known that there are no vagaries on the way? Similarly, when you move forward, if we have that comfort and we know what the snags were, and we know those snags will come very numerically many more times when we start opening up different industries. So you know that whole thing about if you are dependent on a large number of ancillaries, which may be in different zones, that industry may have to look at it differently. And the industry which has easy accessibility to inputs, raw materials, and they are available in their vicinity or even farther away, and the transport system has been ironed out, then those are the ones who should hit the next block. So this analysis CII has done, or you have many eminent people who can talk about it, but I think that we need to have that calculation to say what will be the multiplier effect on the shop floor. On the other hand, the regulators have to also learn what regulations to put in place. Now, this whole thing that keeps coming up is, if one person tests positive in your factory, should you shut down the whole factory? Should you be isolating just the immediates and shut it down for 12 hours and then re-sanitize it and start it off? Because there are many, many industries which are continuous process industries and will present its own challenge. So I'm saying that yes, lockdown has to be lifted in a measured manner. Livelihood has to be restored. The confusing part today is that the labor in large numbers were actually locked down in the lockdown. And as industries are on the anvil of opening up, they, under the pressure of what was built in that labor, they've been allowed to go back home. So they have to complete that cycle of socially and culturally becoming secure before they come back into the mainstream. So these are challenges which will happen. But in this whole cycle, how will we track and what will happen to our numbers that will hit us is going to be a major concern. So yes, we are lucky that it hit us in the late cycle, because many other countries and continents got it before we did in any meaningful form. And there are so many things that was discussed by Dr. Guleria also, that there are hopes on the anvil, and we have Kiran Mazumdar also on our panel, and she can put in the stuff on the biotechnology side. But yes, there are, with the remdesivir and multiple other drugs, there is hope that we will have some, if not cure, but a some sort of mitigating drugs available, which is a good hope. So if you go from the public side, I think that all of us, whether we are in public life or whether we are in owners of factories and businesses that we are going to start, our aspiration should be that we follow the rules to the last T. And the rules are basically those three that we talk about: hand sanitization, the masking, and also the fact that we have on the other hand, we will maintain distance in the workplace. So those are the challenges that you have on your, right? So the basic thing is, hugely, we should now be committed to the fact that it has to be opened. There should not be, and like we all have been talking about, the hot zones will have to be locked up. Okay, so now you have to calculate how that livelihood will come back in each industry, and each industry's floor. We've been helping some of the shop floors to say how you can zone it so that if somebody turns positive, it's only in that zone and not otherwise. So there are many things that we can do to facilitate bringing life. Now, like you said, how normal will it be? I have one message to give. There is a message which is rightfully being given that, look, we'll have to live with the virus for times to come, which is all right. But at the same time, you don't have to think that means that now I can be careless because the virus is going to be around, so I'm tired. Now that would be a big problem for the spread if we let our guard down. And that's why I want to put this perspective to everybody. We have to guard ourselves. That's the only way we will guard our family, our larger community, and ultimately the country. So the doctors are ready. We are ready to fight. There's a lot of concern in the doctors also, and we've been 24/7 trying to say, don't panic, be careful. That's all there is to it. And I think we will be able to deal with it better than most countries.
Thank you, Dr. Trehan, for that opening comments of yours. And you sounded, and thanks for sounding optimistic, but cautiously optimistic, and a lot of hope, of course, as to how disciplined India will be. And I'll come to that particular point very soon too. But as we turn towards Dr. Kiran Mazumdar, whenever on a panel like this, when we look at you and with the two speakers who have spoken, the first question, which is obvious that comes to anyone's mind, that is, when shall we get that cure, or when shall we get that vaccine? And everybody looks to you for that answer. Not just India, and if it comes globally, how fast it will come to India. What's really happening now in terms of how near are we, both for the cure as well as for the vaccine? Over to you.
Thank you, Chandrajit. And let me start by saying that this coronavirus adversity has actually awakened our scientific potential in every possible way. You know, when you look at how India dealt with the pandemic in the early days, you can see how rapidly we responded and really started having a preparedness planning exercise to deal with a large number of challenges that hit us from nowhere. So let's start with testing. We knew that, you know, when we went into this pandemic, and I think Dr. Guleria mentioned it, he said, when we actually entered into this pandemic in early March, we were barely able to test 10,000 tests a day. And from that, we have now come up to over 90,000 tests a day today. How did that happen? Well, let me just share with you some aspects of this testing exercise. When we started testing, we realized that we were very dependent on imported kits. And we also realized that because of this huge surge in the Western world, especially the US, we were going to be rationed out test kits. And we realized that that was going to be a huge challenge for us. So we quickly assembled a group of kit makers in India who very readily rose to the challenge and came out with indigenously produced kits. And that exercise alone has allowed us to be self-reliant in terms of testing. And I think that's a tremendous achievement by our biotech sector. Then we are also developing ELISA serological kits, because you know that we've imported a large number of serological kits which were not evaluated to be at the right standards that we want. So whilst we are trying to procure better kits, serological tests, Indian companies themselves are also developing serological tests. First ELISA, and we've also realized we've got lateral flow test kit capacity, which makes point of care tests in serological settings. And all this is actually now providing us with a platform to bring in all the capabilities that we need to start becoming very large producers of kits for the world. And I think this is a huge opportunity which we never even realized existed in the country. So I think this awakening has certainly made us focus on investing more in science and technology. I think Dr. Guleria also mentioned this, saying that, and Dr. Trehan mentioned that this is a time for us to really invest in science, because today we realize that health science and life science is so important in dealing with these kind of pandemics. And this is what is now the opportunity for India. Let me go to vaccines. Vaccines is a very interesting scenario for India. We are the largest producers of vaccines in terms of volumes. And now is our opportunity to be the largest producers of vaccines which will fight the coronavirus, COVID-19. Let me tell you that India is necessarily an important and integral partner for any vaccine maker anywhere in the world. And this is now providing and giving us an opportunity to be a very important and dominant player in vaccines. So far, we have basically made the kind of vaccines that WHO needs in terms of all its immunization programs around the world. This is the first time that we have realized the urgency and the importance of coming up with a novel vaccine that can fight this very, very difficult COVID-19 virus. But this also throws up a lot of opportunities for innovation in vaccine development. And let me share with you that apart from in the 100 programs for vaccine development that are currently ongoing in the world, there are over 15 programs from India itself. And this is a very interesting, revelation that we too have some very interesting vaccine programs. No doubt we are still at an early stage of development. That's because many of these programs are coming from very small startup companies in the biotech sector. But this also tells us that this is why we need to invest more in science. This is why we need to invest more in these startups and create the vibrant startup ecosystem that can start scaling up. But the important thing is, coming out of all this, we have now quickly created two very important consortiums. The first is something spearheaded by DBT, the Department of Biotechnology. Dr. Renu Swarup, who is the Secretary DBT, was very excited with the kind of indigenization that was taking place in vaccine and diagnostics and treatment developments, that she said, let's start putting a consortium to actually indigenize all that is required to make us very dominant players. And so this is the National Biomedical Resource Indigenization Consortium, which is going to create this platform for bringing together all efforts for indigenization. And then we have another initiative that has been spearheaded by Niti Aayog, which is called CARD, the Consortium of Affordable and Rapid Diagnostics. Again, here we are seeing that a large number of our CSIR labs are actually coming up with some very innovative technologies, but they need to be translated into commercial, scale reality. And this is where companies and these labs are coming together for the first time. And this is another opportunity that has unfolded from this adversity, where the long awaited and wanted academia industry partnerships are finally coming to fruition. And I think many positive things have come out of this adversity, and we should not lose that opportunity. Now, coming to treatments, I think Dr. Trehan said that yes, we have some hopeful signs of remdesivir, but let me tell you, there are many, many other treatments that are coming into the fore. We have, combination cocktails, which recently, have been reported to be very, beneficial for treating these patients. Many immunological antibodies are also being tried, and so on and so forth. And, as Dr. Guleria mentioned, this is not a simple pneumonia-like disease. This is a very complex disease, because it basically is, it causes inflammation, it causes thrombosis, it causes, cytokine storms. So it's a very difficult disease to treat, and therefore you need to understand the disease to treat it. But a very important part also is the early presentation of patients, which is not taking place. I think there's a huge stigma associated with this disease, which must be removed. That's a message that we all need to spread across the country, because it is not a crime to test positive. Unfortunately, today, anyone testing positive is ostracized by many societies, and this is very unfair. These patients are so scared to actually even admit that they're feeling fluish, that they actually come very late. And as you come later, it becomes more and more difficult to treat. There's a lot of data and evidence to show that when you present early with mild symptoms, it's very easy to treat. So I think we need to remove the fear that this particular disease has cast over people by saying that, listen, this is not life-threatening as everyone expects. I mean, today I hear people saying, oh, I hope I don't test positive, because then I don't know whether I'm going to live or die. It is not like that. And I think we need to remove that fear from this particular disease, because we have treatments, we have, and as we keep treating people with better knowledge of the disease, believe me, we will be able to prevent many, many, many deaths. That is, the way we need to look at it. Most of the people who are dying have got very serious comorbidities. We also must look at our country and feel that, look, why do we say it's safe to go back to economic activity in a calibrated way? 90% of our population is below the age of 60. And 90% of our workforce is probably below the age of 40. So I think we are in a much safer, healthier place in that way to combat this disease. The immunity and the immunity of young people is much, much better, because they generally don't have comorbidities like the older people have. So therefore, I believe that having young people in the workplace will not be life-threatening. We must expect that the numbers will go up, because when you start lifting the lockdown, don't expect numbers to magically go down. We will see much greater infection as you test more. So I think what we should really focus on is the mortality rate. And that's what we need to focus on, and see how do we save those people by them presenting early and them getting cured very early. So that's the way I'm looking at the whole aspect. We are in a very good position, because as far as the vaccine is concerned, there are at least 8 vaccine programs in the clinic. 4 of them are already in phase 2 trials, which is also very good news. And as you know, one of them, which is the Oxford vaccine group, is in partnership with Serum Institute in India, because Serum Institute is partnering them for making the vaccine and also participating in a small clinical trial. And they're very hopeful that before the end of the year, they will get an emergency use approval for such a vaccine. And if that happens, we can start vaccinating some of the most vulnerable in our population. And then if that actually starts showing really good data, we can actually get into a immunization phase, where then we can start vaccinating many, many more people. And as I said, there are many vaccine programs. They will need Indian manufacturing. That's where I think we should feel comfortable that we will probably have access to large numbers of vaccine doses for India over the next 1 year. As for whether life will look different, of course it will. We know that until the vaccine really comes into existence and until we see a rapid decline in the deaths because of better treatments, there is going to be a lot of concern. And I think we have to make sure that the safeguards that we have prescribed of temperature checking, mask wearing, and social distancing must be practiced in a very, very regimented way, because I think this self-discipline is called for at this stage. A lot of awareness building also needs to be practiced. And then going beyond that, surveillance is going to be extremely important. Making sure that you are absolutely on top of every single outbreak. Wherever there's a surge in cases, how are you going to deal with it? I'm sure Dr. Guleria is the one who knows how to deal with all these things. He has done that yesterday in Ahmedabad, where he has had to go and look at why these numbers are rising. As I said, it's really about the death rates more than just the positive cases. But equally, we must have safeguards and surveillance with which to venture into the future until we get the vaccine and until we see that the treatments are working. This is what happened in the case of HIV/AIDS, where everyone was so fearful of AIDS. But the moment we had treatments which could show you that you don't have to die, I think people started feeling more reassured. Similarly, you need vaccines to be finally very, very secure. So I'll end there. Thank you.
Thank you. Thank you very much, Kiran, because you have given very strong messages, very hopeful messages, if I can say, some very practical thoughts and advice besides going into the details. And I think a very important point which you have also touched upon is the issue of stigma, which I will come back to during the course if we get time. Great to see stalwarts like you taking full opportunity that's coming India's way amidst these challenges, and to put India really on top of the R&D and health map globally. So thank you very much. We'll get back to you very soon. But let me now turn on the hardcore economy and the economic issues. And the first time in our memory that a health crisis has translated into such a widespread economic crisis, and everybody agrees with that. What implication does that near complete shutdown of the economy have had in the immediate term? What it will have on the immediate term? And what is it that, and how is it that the economy is looking from your own company point of view, from the industry point of view? And there is a lot of course, research which has been done within the industry by CII. Leaders from the industry have contributed to it very strongly. And Naushad, you have led some of these issues. So what's your take on the economy at this point in time, and how do we navigate through this crisis on the economic side?
Thanks, Chandrajit, and thank you, Dr. Guleria, Naresh, and Kiran for great statements. I learned a great deal from them. I've often heard from both Kiran and Naresh and have learned a great deal, and thanks, Dr. Guleria, for adding to the list. Let me speak only about the economy as you asked, Chandrajit. The lockdown, as you mentioned in your opening comments, has indeed been very stringent. Oxford University has ranked lockdowns around the world. Our lockdown in India in its first 3-week phase was ranked at 100% as the most stringent in the world. And the extensions in phase 2 and 3 have also been fairly stringent, especially in the containment, especially in the red zones, the districts that have been classified as red districts. The districts that have been classified as red districts might be only around 20% of the districts in the country, but they account for 50% of the economic activity and output of the country. So the devastation on the economy has been very considerable. I've done a sort of back of the envelope calculation of what kind of impact it's had on our overall output, our overall gross domestic product in the month of April. And my estimate would be that we would have seen around a 40%, so 40% drop in economic output in April because of the lockdowns. That's huge. That's absolutely huge. Now, where does that 40% come from? It comes from essentially industrial activity coming to a halt, except for limited areas of essential services. It comes from certain sectors simply closing, like the travel and tourism sector, naturally, as one would expect. And it comes also from a slowdown in overall earnings and economic activity and consumption in general. So where do we go from here? Without question, we need to see a restart to the economy, and we need to see a restart that, as we've recommended from CII, is organized, safe, and sustainable. And all three of those words are important. First, it needs to be organized. To be an organized restart, we need a few different elements. We need first that the restart be phased, where we start with activities that we know we can organize in a safe and effective way. There is reasonable evidence that in manufacturing, one can set up processes in a very safe way, such that there is no spread essentially that takes place within manufacturing. Manufacturing companies are used to following particular routines, they're used to following particular practices, and it's simply a matter of building in those safe social distancing practices as a part of one's day-to-day working practices. This is what we've done in our company. This is what hundreds of companies around the country have done as a part of their safe working practices. And companies themselves have the biggest incentive to keep their own workforces completely safe. So getting manufacturing restarted substantially across the country and across all sectors without any distinction for essential and non-essential is very important. If you look at the rest of the world has been much harder hit than we have on the health side, but manufacturing has been much harder hit in the country. Only in our country has manufacturing essentially been halted. There's a large German multinational that has 1,500 plants around the world. Only 22 of their plants were closed, all of them in India. We have a joint venture with another German company. They have plants in Brazil, in Germany, in France, in Italy, in the UK, in Russia, in China. All of their plants have been operating. The only plant in their group that's closed is our joint venture in Pune. So it's possible to actually organize manufacturing in a safe way and ensure that it actually operates in a productive way and in a safe way at the same time. Second, come to logistics. One of the things that I think we did in a very poor way as we imposed the lockdown was the way in which we handle logistics. We simply stopped the movement of trucks around the country and said we'll figure it out later on. And we needn't have done it in quite so uncoordinated a way, because it's taking us a huge amount of effort to restart logistics across the country. Truck drivers don't feel safe. They worry about actually being able to get fuel in different petrol pumps. They worry about getting food along the way. And even though there have now been notification after notification coming out of the Ministry of Home Affairs, these notifications themselves are an illustration of the pain that the sector has undergone and the logjam that has taken place. We really need to put a lot of effort and a lot of coordination into sorting out things at the very last mile, because a notification issued in Delhi gets transferred at the state level in a variety of different ways between different states. And then when it reaches the end policeman interprets those state notifications again in a different way. And I think we can coordinate that entire effort much more easily. As you know, what we've recommended from CII is a coordinating group that consists of union government representatives, consists of state government representatives, and consists of people from enterprises locally, so that you can deal with these issues which come up on a day-to-day basis. Just to emphasize the organized reopening point, if you want the opposite of organized reopening, look at what's happened with liquor shops in these last 3 or 4 days. It's the opposite of organized. First, there's a question as to why they were closed in the first place. Second, given that they were closed and we were reopening them after 40 days, when we reopened them, we reopened for some reason only 20% of them. Now, demand is going to be there, it's pent up demand, and you then reopen only 20%. You should expect the cues. It doesn't take a genius to actually predict what we saw happening on our TV screens 2 days and 3 days ago. And then you have uncertainty whether they'll continue to be open or not. So everyone decides that they'll go out and get their liquor that same day. So I think it's possible to think through some of these issues in a much more effective way and see them implemented much more simply and in a way that's much less painful to the individuals who are these economic actors, and also in a way that's more effective economically. The second area is safe working. As I mentioned, industry has put together many safe working protocols. But one of the big benefits that we can get from seeing industry and the subsequent supply chain, retail, independent retail stores, etc., reopening, is that people can learn safe working practices and then take them home to their communities and spread those safe working practices as safe living practices. Why is social distancing so important? Why is washing your hands periodically so important? How do you wash your hands effectively? Why is the wearing of masks so important? Why is the right quality of masks, as Dr. Trehan has so eloquently told us in the past, so important? These are the things, these are simple principles, but these are simple principles that need to be understood by 1.4 billion people. And for that to happen, we can play a role in industry and in the enterprise sector in spreading these safe working practices, these safe living practices across our society. Finally, in terms of sustainability, whatever reopening we do has to be something that is sustainable. How will we make it sustainable? As was mentioned earlier on, we're going to have to live with this virus, and we're going to have to live with this virus for a period of time, probably for the better part of the next year, until we have a vaccine that is available in enough quantity and with enough demonstrated proof of effectiveness on the ground for it to be administered across so many people. So if we're going to live with the virus for this next year or so, then how do we open the economy in a safe way, in a systematic way, and in a way which is transparent, where there is a lot of communication and discussion and so on, and one knows, okay, if the number of cases goes beyond this in this micro area, then we will limit further opening until we control it, or even close down further until we see a drop in the number of cases and the spread of cases. In other areas, as we see cases dropping, we will reopen in this way, and it's all transparent and announced ahead of time. I think it's possible to actually work out some of these dashboards so that everyone knows what to expect. Today, I think otherwise, if we operate in an environment where we're waiting to hear with bated breath to hear what the Prime Minister announces one day, or what the Chief Minister announces one day, or what a local bureaucrat or municipal commissioner announces, and that determines how things are going to go, I think that's unnecessary. I think as a society, we should have something that's much more transparent, something that's much better communicated, and something that's much better coordinated. A final comment in terms of economic recovery. I mentioned that in April, at least my back of the envelope calculation says we saw a fall in economic activity of 40%. Can we bounce back from this in a month? I think we could have earlier on. I don't think we can now. I think it's going to take a longer period of time. I think it's going to take a longer period of time for one single reason. And the single reason is the loss of earnings for people. What we've seen happen in this last 6 weeks, 7 weeks now that we've had the lockdown is the loss of huge numbers of informal sector, what economists call informal jobs. People who are shop delivery people, helpers in shops, tea sellers, small restaurant workers, dhobis, a whole variety of informal services that cities actually live on. They're the ones who also have been really a part of the migrant crisis that we see, because many of them have come to cities from other parts of the country and have suddenly found themselves with no cushion and no livelihood and no earnings left. So our recommendation has been from CII that we need to provide bottom of the pyramid support in the way of direct benefit transfers through Jan Dhan accounts to all people. We shouldn't worry too much about perfect coverage, about duplication of providing benefits, etc. at present. We should just worry about coverage, trying to get some money to everyone. The second area of support that we've recommended is enterprise support. And what we've been asking for now for over a month from CII is, look, there's this norm that's come out that says pay wages, keep paying wages. It's the right thing to do without question. But enterprises have varying degrees of capability of sustaining the payment of wages when their sales is zero, right? And I'm saying many enterprises have seen zero sales in the period of the lockdown. And if you see zero sales and have zero cash coming in, how do you sustain then wages on an ongoing basis? So what we've recommended is to use the banking system as a way of providing loans at a modest rate of interest, but it's not a subsidized rate of interest. It's a rate of interest 4 to 5%, which is higher than banks earn by keeping their money with the Reserve Bank of India. Today, banks have 8.5 trillion rupees sitting as deposits with the Reserve Bank of India, earning a little over 3% interest, for the simple reason that they are risk averse and they do not want to lend the money out because they're afraid of not getting it back. So what we've asked for is a government guarantee to backstop those loans, a government guarantee that would cover 3 months' wages for the entire enterprise sector and use the banking system to lend out this money that's sitting with the RBI to enterprises. And let those enterprises be a small shop, let it be a large construction company, let it be a manufacturing company, let it be an MSME, let it be an airline, it doesn't matter. Use the money that's sitting with the banks to go out to the enterprise sector as loans, charge the enterprises 4 to 5% interest, cover 3 months' wages, provide a 6-month moratorium on the interest payments, and have the interest repaid then and the loans repaid over the next 2 years. If we do this even today, we should have done it a month ago, and I do not understand why we've heard nothing from the government in the way of an economic package at all. I just do not understand that. If we do this even today, I think we can still see a rapid recovery because we will sustain security of livelihoods. We can sustain the confidence that people have that they will have earnings going forward. And if we sustain that confidence in society and provide those livelihoods to people on an ongoing basis, we can see a much more rapid economic recovery than we will otherwise have.
Thank you, Naushad. That was very, 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 very detailed, I must say, and you've covered all aspects of the economy at this point in time. So I'll go to Vikram for his opening comments, and he's been waiting. But I'd like to request you to focus, because Naushad has really covered almost all the issues that we have been talking about on the economic front. But I really want you to focus, Mr. Vikram Kirloskar, on the issue of which has been really of concern for all of us in the last few weeks, the role of migrant workers, say for instance, in the economy, and which is now being realized to be such an important role that they have played. And it is now clear that the huge informal sector also of 23 crore workers that makes livelihood very fragile and very, very sort of unstable. Workers are really seeking refuge in their home places and abandoning the work in industrial districts. How can we alleviate really the sufferings of the household at the bottom of the income ladder, apart from providing income support, which Naushad talked about, the role of industry as you see it, and what is your take on and the role that in Indian industry can play in showing leadership in this matter?
Well, thank you. Good afternoon, everyone. You know, it's a few days back, I started realizing that the end of the lockdown really means we have enough hospital capacity around the country. COVID is not going to go. I used to always think, yeah, COVID will taper off and it'll all feel safe. But really, it's like there's a lot of hospital capacity around. If more people get it, it's easy for us to take care of it. And as Kiran said, you know, the safety factor will start coming in, that I will get treated. Now, in my mind, and whether you're talking of immigrants or immigration and migrant workers, I think the most important thing industry and individuals have to do is think about respect for the people and work on a basis of individual responsibility. When we start our factories or when we go back to work, if we are responsible ourselves to putting on a mask, washing our hands, and staying apart from people, that will be the best thing that can happen. I understand, of course, there are lots of medications and things coming out, but the simplest way to spreading the virus is by these 3 or 4 very basic physical habits. So it involves a lot of self-discipline and self-responsibility, which is important. Regarding migrants, it's affecting our industry, my industry, the auto industry, where 80% of the suppliers and the dealers are in red zones. And a bulk of the suppliers, right from the tier 1, tier 2, and tier 3 suppliers, many of them function with migrant labor. So we have a combination of the suppliers and the dealers being in the red zone, as well as a large amount of the employees being migrant labor. The labor in a car assembly plant is relatively small as it is all automated, but the supply chain on either side, the supply chain and the delivery chain, has a lot of people. You know, how the short-term issue is how do you get them back, pay them properly, look after them, and get them safe. But I think long-term, it's going to be difficult to get migrant labor again back working in the country. And as industry, I think we have to look at the states where this migrant labor has come from. Can we open our industry in those states? If you look at the concentration of the auto industry, there's a concentration around Delhi, there's a concentration around Bombay, Pune, and there's a concentration around Chennai and Bangalore, whether it's the car companies or whether it's the suppliers. I think this has to spread out a bit where the migrant labor is also coming from. And perhaps this is an opportunity, again, if we look at ourselves as responsible industrialists, to see how we can build the rest of the country up, where these poor people have been forced to come out and find work. That's one way to look at it. This requires a number of things. I think this requires a whole change in the attitude of our rules and regulations. It requires a change in labor laws across the country. It requires change in incentives. This is a good opportunity, again, when we are in a tough situation, and for the first time we see pretty much a large amount of cooperation between center and states getting on the same page to a large extent, even opposition and the ruling party supporting each other to make large reformation changes in the way the country operates. How to get the it's not only ease of doing business, but also cost of doing business. Both, how do you control both these issues? We have been asking from CII regarding both these issues. Cost of doing business, look at the supply chains we have in India or the value chain we have in India, compare it with our competitors in China or Vietnam, and then see which are the areas which can, where we have to reduce our costs or improve our efficiency. I know for a fact in the auto business that factory costs are very, very competitive around the world. And therefore you can see the auto component industry has been exporting quite dramatically, and the increase has been quite dramatic over the last 10, 15 years. But if you really look at the entire supply chain, entire value chain, from the raw material to the finish in the auto sector, and compare it with some of the other countries we compete with, I think we'll find more areas where changes can be done in various laws to make it far more competitive and do even better. And another example is in the textile industry. We export textile machinery, cotton, yarn to Bangladesh, and they're able to get the entire garment business. And we are losing out to garment business there. So I think these are the kind of things we have to look on the value chain side to see what changes we have to make in our country to get back into the economic scene. All the previous speakers have talked about safety, process changes in the factory. I think all that will get done. Most industries trying very, very hard to ensure people are safe, labor is safe. The bigger issue, as Naushad said, is although you want to pay salaries, how will you pay salaries? And the fiscal incentive coming up is going to be very, very important. See, finally, it's an issue of the health basket and the economic and livelihood basket. It's like the chicken and the egg. You cannot, as many people have said it, I'm just repeating, you cannot have health without the economy, and you cannot have the economy without health. And we have to come to a balanced way of opening up the economy whilst looking after health. Both are equally important. I think we are lucky that the lockdown was so effective, as you said, 100% as per some rating. And there is certain amount of, when you look at the numbers in India and you look at the numbers around the world, when I talk with my friends around the world, especially in some parts of the world, we are so much better off. We have to continue that better off and do as we open the economy. I think that is essential. And that from the industry's side is very, very important. One issue, when you ask about migrants, some states have started changing their labor laws. I think from CII side, we feel it's important that all states relook at their labor laws. We are not saying just open up the labor laws. I think we need flexibility as well as safeguard of labor. It has to be balanced there again. But we need the flexibility as well to make India attractive for investment. There's a lot of talk going on about companies exiting China, trying to redo their supply chains. So we need to get everyone and make India attractive for investment as well. So labor laws is one issue. But again, look at both sides, safeguards and flexibility, and take care of both. Flexibility will help on investment. Going forward, some numbers for the auto industry. I see a lot of questions in the chat on people asking on what's going to happen to components and when will auto industry start getting back to normal. As everyone knows, April was pretty much a washout. Half of March was a washout. The supply chains are tough to restart, starting from the dealers. Although some have started in the green and something a little bit in the yellow zones. But that hardly, the red zones account for 70% of the sales in auto. I don't see auto coming back to some semblance of normal till June 2021. This year, we are forecasting in the auto industry a reduction of about 40% to 50% in our normal output. We'll be at 2010 numbers, roughly. Getting things restarted, as I've been doing, slowly trying to get our factories restarted. The biggest issue is people are scared. But what Kiran was saying, if we have to get things started, we have to get a safe feeling amongst individuals. And the biggest issue are people are, there's always someone question in someone's mind. When I go out, when I go to the factory, is there a chance of getting infected? And I think we have to overcome that, provide enough comfort through visible actions that they are going to be safe as industry, whether it is for our existing employees or for the migrant labor to come back. and restart our economy. Thank you.
Thanks, Vikram. We have actually spent about more than an hour in your opening comments, which were very, very comprehensive, very, very important for our viewers and for everyone concerned. I have been actually noting some of the points that have come out from each one of you, but I'd like to have now some very short comments in the next 20 minutes or that we have on a particular subject that has been touched upon willy-nilly by everyone. And I am really talking about when February onwards, we were looking at this as a disease of the elitist. Some people who are traveling internationally, they are getting affected. Slowly, we are seeing that this is not so. And more people, we have seen crowded places, Dharavi, others, where it is becoming people living in small spaces, where it is becoming very, very difficult and a huge challenge. And I want comments from each one of you on this particular point that I'm raising. And I'm also seeing a lot every day. One hears about the stigma around it. All of you have said that we need to live with it, but we are seeing the huge stigma, and some of you have raised this point as you spoke. One person found COVID positive in one plant, asking the plant to shut down, the person being ostracized. There is a lot happening around that person. So each one of us, many of us might just be having it and we'll have to make do with it. But that does not mean that we are going to see, and there's a lot of fear that we are also seeing around. People are frightened, people scared of the images that they are seeing on the television channels and so on and so forth. And we are talking about opening up. India always gets challenged sometimes on this entire aspect of discipline. So Indian industry would have to be disciplined. You all articulated, some of you, very clearly the type of protocols that would be put into place by industry. Would we abide by that? Would we citizens abide by the type of protocols that would be set for ourselves? How will we together be able to get out of the stigma, handle it, be disciplined, both industry and common man? I'd like response, very quick rapid fire response from each one of you. I'll start with Dr. Guleria and then I'll go down. Dr. Guleria.
I think these points are very, very important. As you rightly said, this is no longer a disease which is of the elitists. This is now a common man's disease. And obviously the risk factors are those related to overcrowding, where social distancing and what all the steps that we keep talking about are nearly impossible to really do. Because if you have 5 people living in one room, the issue of social distancing and being able to home quarantine yourself really doesn't exist. Unfortunately, we have a huge stigma to this illness, which is not there. It's like any influenza-like illness. It does have a mortality, but that mortality is not as high as could have been with MERS or with the SARS infection. And we need to really project it in that manner. And we need to really get this stigma out, because it is causing higher deaths, people not coming. And like you said, as we come out of the lockdown and we start our industry back, this will be a huge hampering factor, because people will come for work without really coming out of the fact that they may have a flu-like illness, which may account in them losing their job or losing their wages, or their friends in society or in the factory may sort of shun them. I personally feel that there is a huge need for us to really start a little bit of an activity on citizens' responsibility. Each one of us has to really push this forward through various activities, through various means, that this is not that severe a disease. We can come out of it, but we have to be responsible. We have to really start our work in a lockdown situation. Social distancing, physical distancing is a better term, I think. Physical distancing, so hand washing, wearing a mask should become a norm. And if we do that, and we are able to sort of self-quarantine ourselves if we have symptoms, we will actually be able to decrease the cases and be able to have our economy, our industry back. But I think that is the biggest challenge, because what happened in the liquor shops is a reflection of how it's easier said than done. And that's the huge challenge that we have in our country right now.
Thank you. Dr. Trehan?
So it's a three-way partnership as we move forward. One is that there is still a lot of confusion in the recommendations that come out. On a daily basis, it's being changed. So people get, the employers get confused, people get confused, and in the healthcare industry get confused sometimes because we don't know what the real regulations are. So I think that there has to be, and Dr. Guleria being part of the government could make it very clear that we now put out recommendations, protocols for everybody very clearly, and let it be go down from the center, and we must tell the states also, and the last man standing who's the enforcer, because the DCs are under huge pressure that you should not have any in your area. They will be draconian in some ways, not so draconian. So there is a lot of confusion. If we can work on that ourselves from the healthcare side, I think it will be a huge thing for the industry to understand, the general public to understand. By nature, we are not careful people. We are not disciplined people. So we have to work that much harder at every level. We have gone blue in our face to every day we are on TV. Guleria is even more than I am. But we are always stressing the three dharma. This is your new dharma. You may be any religion, but the dharma today is only three things. And that's basically, we have repeated it so many times, but if everybody repeats it on a daily basis, it'll be better. Now, the challenges to you are huge, by the way. The second part is the relationship between labor and the owners and how this moves, because we can say that, yes, we are being very careful, we are doing, but how do we account for it? So basically, we need to go and do what we have to be able to say, yes, every industry in its starting points have adhered to these three things. And fourth is the outcomes. If you have something in your factory, please don't hide it, report it, and hopefully there will not be any wild reaction against it, and we can actually keep it contained. I think if these three things are done in a partnership way, we will be able to kickstart livelihood in the next months to come.
Right. Thank you. Thank you. Kiran, what's your message on that?
Well, I just want to expand on what Naresh just said. I think there has to be a good partnership between CII, like industry body, and the health ministry, because we are seeing a lot of conflicting messages. And I think that is causing a lot more concern, both at the center and state levels, than just, following out any sort of guidelines or messaging coming out from one statutory body. I think there needs to be an understanding. For example, you just mentioned, Chandrajit, that there was a company that was made to shut down because of one case of a positive testing employee. Of course, it spread to many others. But I think there are ways and means of dealing with these outbreaks, even in the workplace. From a company's point of view, I think we can do our best to make sure that we address some of these safeguards and surveillance methods, like zoning in our big campuses, making sure that people wear masks all the time, making sure that we temperature check every single employee. And we've also worked, as you know, with CII to come up with certain workplace protocols which can be shared everywhere. Now, these kind of guidelines also have to be a message by the government. It cannot just be CII messaging it to its members. But I think if we can work with the government so that they understand what are the practical difficulties of some of the ministry's guidelines, and how we can basically merge them and come up with much more practical guidelines, is really my view. And I think we are working in silos in many of these guidelines. Yesterday, there was a mention saying that, mild cases don't have to be tested before they are discharged. Now, we are all very confused. What does that mean? All this time, you wanted 2 negative tests before a person is discharged. Suddenly, you make a change in that. Now, where is that thinking coming from? Are they discussing with us to know why these kind of things are happening? So I personally believe that there should be a much closer partnership between industry and the government to come up with that. This is the economic phase. So that's why I think industry needs to be far more coordinated and working closely with the government agencies for any new guidelines that are coming out for the workplace and for lifting the lockdown in a very systematic way. I loved what Naushad said. He said it has to be systematic, safe, and sustainable. Those are the 3 S's that we really need to focus on.
Lovely. Thank you. Thank you very much. So both Vikram and Naushad, you are 2 large employers. You are having a large number of people working in your factories and plants. What's your message? What's your message, and how do you think industry will evolve in terms of these protocols that we talked about? Would industry be disciplined, and how would industry itself be able to get traction from across the country?
Good.
Vikram, Vikram, yourself. Sorry. Yeah.
I'm starting? Okay. You know, I went out shopping for food 2 days ago after a long time. I tend to go shopping in my normal, I like to cook, so I go out a lot. 2 days ago, I went out shopping in the day between the curfew time, 7 a.m. to 7 p.m. And I was wearing my mask and gloves and hat and all protective equipment. But I go out and I see most people are pretty well covered, but the people who are not wearing a mask and people who are not very properly covered are people who look obviously educated and relatively wealthy. I think it's very upsetting when you see this. And I think the first and the most important thing for everyone in this country, if we have to get our economy back into shape, is to have discipline to follow the 3 things that Doc has said. Again, on the mask, on washing hands, and being a little protective, and staying 6 feet away or 5 feet or whatever away from each other. This looks obviously fundamental. We are trying very hard. We've made manuals for the dealers, for the factory, for the suppliers, very detailed manuals with pictures and training programs. How do we look at keeping ourselves safe right from starting, leaving the house to entering the factory to going back out? What can we do at dealerships to make the customer feel safe? That when I come into a dealership, this is as safe as my home. When I buy a car, I know it's been completely disinfected and I can take it back and be safe about it. I think we are trying very hard through manuals and trying to educate people. But finally, it comes down to individual responsibility. I have to have it in my heart that I respect the people around me and I will do what is required to protect the environment. I think that is very essential. And when I look for communication from within the government and within ourselves and whoever, I feel this should be the first and most primary communication and most stressfully informed communication, as Doc has been saying. They've all been doing it all the time.
Thanks, Vikram. Naushad.
So, so I fully agree with everything that that has been said so far on how we need to safely operate today. And I think we can follow these practices very effectively. I'll make only one comment about that, and then I wanted to make one comment about a longer term fix. The short term point is, if we stick to an absolute implementation of these 3 principles of wearing a mask, washing hands and availability of sanitizer everywhere, and social distancing. And those are the things that are absolutes that we implement, and every last individual and last policeman has to implement. And beyond that, we actually start moving to a more open society and a less controlled society again, which will enable economic activity to thrive. That's the one short-term point. The longer-term point is that, there's this saying that everyone has heard, that you should never waste a crisis. And I hope we don't waste this crisis to fix 2 really fundamental problems that we have in our country. One of the problems has been raised in many of the questions that have been on the chat, which is we have this dichotomy, we have this real difference between how we treat informal labor and how we treat formal labor. Formal labor is fully protected and very inflexible in terms of our labor laws. Informal labor is almost completely unprotected and very flexible. informal labor accounts for over 80% of the labor in our country. Formal labor accounts for less than 20%, and it's the informal labor that is growing. So we need to see a convergence. We need to see a new labor contract and a new set of labor laws that would apply across society, that provides a minimum of protection, insurance, basic wages, etc., and a lot of flexibility for the employer. Because if we can do that, then we can see a convergence where you have a combination of flexibility with minimum protection that applies across the workforce instead of this very differentiated system and really dysfunctional system that we see now. It will simultaneously address the migrant labor issue. The second big thing that we should try and fix going forward is slums. You know, we in cities, we think we take them for granted and we shut our eyes to them when we go past them. And probably when now it's been brought home to us that actually that's not an acceptable way of living in the long run. We need to address the fact that half the population of Bombay lives in conditions that are really horrible. And that's not an acceptable way for the country's richest city to live. So how are we going to fix it? How are we going to provide decent quality of housing? Use the land that gets freed up from the slums. Provide the housing for people with them having the slum dwellers having property rights to the new houses that are provided. Monetize the land, redevelop the land, have more people from other slums living in accommodation there. And we fix this once and for all going forward. It's probably a 5 or 10 year project, but it's a project that can really deliver a very much better country and society for us.
Thank you. Thank you, Naushad. Thank you. We're running out of time. We have 5 minutes and we have 5 very, very eminent panelists. And so I have 1 minute to each one of you on one question. What will be your new normal? One thing that you would be doing differently now and post-COVID? Dr. Trehan?
So first thing, I would demand from the government that they actually fulfill their commitment to allocating the budget, the 2.5% of the budget to healthcare, so that this does not keep repeating itself. There are 3 parts to it. One is that there is already a scheme, Swachh Bharat. There is another scheme, Swasth Bharat, and the third is Ayushman. These are sisters. We have 3 different commands. They don't talk to each other. There's total wastage. So we should revamp our healthcare delivery system and fund it well so that we don't find ourselves in this position, because pandemics will come back again and again, and we should not be left like hanging like we are at this point.
Thank you. Thank you. Kiran?
Well, I definitely want more spend in science and technology. I think we should increase our investment in research and innovation. And I would like to see a doubling of the spend in the budget. But more importantly, to add to Naresh's point, I would also like to see the Ayushman Bharat, which started off as a universal healthcare model, extended across the country in a very equitable way, which will also answer Naushad's point of how do we bring the informal labor under health insurance. And finally, I would like to see our primary healthcare also being invested in a much bigger way. And I would like to see this actually become a very important part of also the Ayushman Bharat model as it moves forward.
Very good. Thank you. Really rich points. Naushad?
So, when you asked the question, Chandrajit, I was going to talk very personally about, I hope to travel less. I hope to do more of my work on video conferences, working from home, because it's working rather nicely. But since everyone else is giving such, such inspirational messages, let me just say, I think we could focus a lot as a country on primary education outcomes. I think we have, just to supplement primary health, I think a focus on primary education, on education outcomes at the end of standard 2, as many people have documented, is a critical outcome that we should chase as a country. It will be the foundation for many of the other improvements we wish to make. Thanks,
Vikram Kirloskar.
Well, personally, less travel. I travel a lot, spend more time at home. But, on on a short-term basis, look at how we can protect jobs in the various businesses I have. That's going to be the primary focus right now. How best to protect them, how best to get them occupied, retrain, and be prepared for a future. And in the long term, probably look at different business models, which will make sense post-COVID. I think I have to look after our stakeholders. I have a responsibility to all the stakeholders, whether shareholders or employees or suppliers and dealers, and my whole community I have to look after.
Thank you. Last word, Dr. Randeep Guleria.
Okay, thank you. I look at the things that can be done as three categories. One, of course, is that this is an opportunity to really push for preventive health. If you look at what has happened in the last few days or weeks of the lockdown, a large number of communicable diseases has come down. So we should really look at this as an opportunity to have better hygiene, whether it be hand washing, whether it be wearing a mask or social distancing. A lot of communicable diseases have actually come down because of all these strategies. Second thing is, this is an opportunity for us as a country to invest more on research in science and in medicine. We should become self-sufficient in a number of areas, as was already mentioned, in vaccine and in kits. And thirdly, I think we should use this as an opportunity for people to come together for the betterment of the country. And that I mean academic institutes, industry, to really merge and try and see how they can move forward as far as making India a superpower in terms of science and medicine is concerned. We work separately, the private sector, the government sector, the industry. There is a need for it to really merge as one in terms of developing new products, new ideas coming from academia and going into industry. That's what I feel.
Thank you. Thank you very much. So really, as we started off the panel with Jaan Hai and Jahan Hai, I think that's very important. The message came through very clearly. As a society, we need to be responsible. We need to also see to it how we can help process this change that we are all in, and the leadership required from every sections of the society, be it the government, be it industry, be it society, civil society, and also a partnership approach, private-public partnership, partnership with the government, and a huge opportunity at the end of the day for India. Lady and gentlemen, what a fantastic panel. Thank you, Kiran. Thank you for being there. Vikram, thank you very much. Naushad, thank you very much. Dr. Naresh, Trehan, fantastic. Thank you very much for being there. And Dr. Randeep Guleria, all the very best to each one of you. And thanks for being a lovely panel this morning. Thank you.
And thank you, Chandrajit.
Thank you.